Now we will go to the third part of our lecture, which is the thyroid and its relation to the eye. When the thyroid affects the eye, it's called either Graves' orbitopathy, Graves' eye disease, Graves' ophthalmopathy, ophthalmic Graves' disease, thyroid associated orbitopathy, thyroid eye diseases. All of these synonyms are the same, for it means affection of the eye by thyroid gland. The onset of affection of the eye, it could be occurred either before increase in the hormones of thyroid hormones, or it may be both at the same time, or it may be after increase of thyroid hormones. So it may be before, it's called, if it's before Graves' eye disease, it's the same at the same time, or after the thyroid hormones increased, it's called thyroid associated orbitopathy. Okay, this figure show that when the thyroid hormones increase T3 or T4, it will result in increase of specific antibodies. These specific antibodies go towards the orbital tissue, towards the muscles, orbital muscles, and to orbital fat and the eyelid, where it will adhere to specific thyrotropin receptors and result in increase of the amount of glycosaminoglycans and anti-orbital muscle antibodies. This it will result in increase of the tissue size, which later on it will turn into fibrosis. So the first stage is edema, and then second stage is fibrosis. There are many classifications for the thyroid eye diseases. The most common one and famous one is called no specs classification. It's divided into class 0, where there is no physical signs or symptoms, and class 1, only signs. 2, it means soft tissue involvement, and 3 denotes proptosis, 4 extraocular muscle involvement, 5 corneal involvement, 6 sight loss due to optic nerve compression. These photos show some of the manifestations of thyroid eye disease. In the upper one on the left, there is upper and lower lid retraction of the right eye, the same in the lower one, and denote that the middle picture showing that there is lid lag. When the patient looks downward, there is lid lag. The lid not follow the movement of the eye downward. So the most important lid manifestations is the starring lock, which is due to upper and lower lid retraction, and lid lag, it is due to inability of the upper eyelid to follow the movement, downward movement of the globe. This is another photo showing soft tissue involvement, which in the form of eyelid edema or chemosis in the conjunctiva, also redness over the recti muscles and lower forehead. Okay, the other photos here showing that there is esotropia. Esotropia is manifested as enlargement of extraocular muscles, the four recti muscles. It will result in compression of the optic nerve, with optic nerve edema and affection of the pupillary reaction, affection of the color vision, and drop of vision. First, what are the simple measures that may help the patient with Graves' orbitopathy? The first one is giving artificial eye drops to help surface symptoms. Also, tapping of the eyelids at the night to protect the cornea during sleep. Giving imprism, it will help in relieving diplopia. One line of controlling the eye manifestations is controlling the thyroid function or the hyperthyroidism. This could be through surgery or giving antithyroid treatment. As we see in these two photos, the first one on the left, that the patient have a large thyroid gland enlargement, and after surgery the eye manifestation is improved. Another line of treatment is giving the patient steroid injections, which to help to control the inflammatory manifestations and develop the immunity, so improve the eye condition. And these two photos, the patient before on the left side and on the right side after intravenous steroid treatment. Also ortho decompression is last line of management, is trial to remove some ortal bones. Usually we remove the floor and medial wall or the lateral wall. It may be one wall decompression, two wall or three wall decompression, allowing these enlarged tissues to find space to fill, not to decrease the proptosis which is occurred. How to manage strabismus occurred due to thyroid associated orbitopathy by recession of the muscles. In thyroid associated orbitopathy there is no resection, only recession of the muscle, and this to achieve binocular vision again. You can treat lid retraction either by surgery or by Botox injection. In these photos we can inject Botox in the molars muscle and levator muscle to induce ptosis. These photos shows lid retraction before and after lid surgery. This lid surgery is performed is blepharotomy to improve or to improve lid retraction or to induce ptosis.